Good afternoon, everyone. Thank you for joining the masterclass. My name is Marguerite. I am a lawyer, partner at Fieldfisher, specializing in tech, data, and AI in the field of digital health. One of my main areas of interest, and also one of my core activities as a lawyer specializing in digital health, is the reuse of health data. So we work daily on projects related to health research, reuse of data for AI systems, a driver for research, and also health data warehouse and strategies for data valorization. I see health data reuse as the art of sustainability for our healthcare system, and also a driver for research and innovation, and a key enabler for AI. So I'm delighted to be here with you all, as this session gives the opportunity to take a comprehensive look of the legal framework, the new European initiatives that is shaping the future for digital health and AI in the field of health. So why, sorry, I forget my slides. So why is health data reuse so important? As mentioned, health data is extremely valuable for innovation, development of AI, and personalized medicine and research. However, because health data is considered sensitive personal data, there are many barriers for the reuse, especially in Europe. So the challenge, of course, is to balance innovation and with a strong data protection. So to understand this challenge, let's have a look at the legal framework that governs health data in Europe. Under the GDPR, as you all may know, health, genetic, and biometric data are special categories of personal data. Processing these data are generally prohibited unless certain exceptions apply, such as individual consent, medical care, public interest in the area of public health, or scientific research. Moreover, GDPR allows member states to introduce limitations or additional conditions, as France has done through its Loi Informatique et Liberté. So let's take a closer look at how France has implemented these rules and added its own conditions for health data reuse. In France, unless patient's consent has been obtained, the processing of personal data must, first of all, pursue a public interest purpose, and secondly, can only take place after completing the required formalities with the CNIL. Either a declaration of compliance with a CNIL framework or a formal authorization. Since October 7th, 2021, we have in France a dedicated framework that governs the processing of personal health data for the creation of health data warehouse by controllers acting within their public interest missions. For the record, health data warehouses gather and store large volumes of data for research or innovation and for a very long period. For other controllers than those acting within their public interest mission, prior formalities, formal authorization is required before creating a health data warehouse. And in addition, any health data reuse of the health data warehouse will need to be implemented within a secured internal area, named a project space, and subject to its own public interest purpose and new prior formalities. And only data that have been anonymized beforehand may go out of the health data warehouse and be shared. Indeed, before discussing the technical aspects of this technical aspect, it is very important to understand that two distinct regimes for health data reuse coexist in Europe. depending on the nature of the data, either pseudonymized or anonymous. The first regime concerns the reuse of pseudonymized health data. Pseudonymization means that personal identifiers are replaced with codes or numbers, but the possibility to re-identify individuals still exists if additional information is available. This type of data is still considered personal data under GDPR, and its processing is subject to the before-mentioned strict conditions under both GDPR and French Loi Informatique et Liberté, and also, of course, robust governance and security measures. The second regimes concern the reuse of anonymized health data. Anonymization goes a step further. All information that could identify an individual directly or indirectly is removed or modified. And once data is truly anonymized, meaning it can no longer be linked to any individual, even indirectly, it is no more considered as a personal data. As a result, it is not subject to the GDPR, and it can be reused freely for research, statistics, and innovation, of course. However, achieving a true anonymization is technically very challenging, especially for health data. Moreover, anonymizing data can reduce its value for research, as of course it limits the ability to link data sets and perform detailed analysis over time. In summary, while anonymized data offers more flexibility for reuse, it is often less useful for advanced research. Pseudonymized data, on the other hand, retains more value, but is subject to strict legal requirements. So let's now have a look at some recent legal developments that are shaping the landscape of health data reuse in Europe. On the 5 September 2025, the Court of Justice, the European Court of Justice, issued a significant decision regarding the concept of pseudonymization. The court has written a subjective approach to identifiability. Whether data is considered personnel depends on whether the recipient of the data has the means to re-identify the individuals. For example, if an hospital pseudonymizes patient data before sharing it with an AI provider, and the AI provider does not have access to the key that links the codes to identities, the data may not be considered personnel data for the AI provider, depending, of course, on the data shared, even though it remains personnel data for the hospital. So this subjective approach can facilitate, of course, data sharing and reuse, as it recognizes the risk of re-identification depends on the context and on the parties involved. In the same way, a recent draft regulation named Digital Omnibus proposed changes to the GDPR and the concept of personal data. In particular, the European Commission has proposed amendments to the GDPR to clarify the definition of personal data. Based on the last CG EU decision that I mentioned before, the new definition states that information is not necessarily personal data for every organization, just because another entity could identify the individual. This change would make it much easier to reuse data in certain situations, especially for research and for innovation. New measures have also been introduced to facilitate the implementation of research and innovation. A new broad definition of scientific research has been proposed, covering any research which can also support innovation, such as technological development and demonstration. It confirms the broad scope of the concept of the scientific research covering innovation. And legitimate interest may be the legal basis under Article 6 of the GDPR for developing an AI system. and a new exception for individual information before conducting research, where public information is available, has been introduced also. And last but not least, we have a new exception proposed, amending Article 9 of the GDPR for processing special categories of personal data, including health data, for the purpose of training, testing, or validation of AI systems. For example, if it is not possible to achieve bias detection and correction in AI systems using only anonymized data, the use of pseudonymized or even identifiable data will be allowed, of course, with robust protection in place. However, the additional French condition and the prior formalities will remain fully applicable in France until our Loi Informatique et Liberté has been amended. And same in the other countries, of course, European countries. In any case, these legal developments reflect a trend toward a more nuanced and flexible approach to data protection, which takes into account the context of the data reuse and the technical measures in place. For health organizations, which are necessarily all involved in health data reuse, it is crucial to stay informed about these legal changes and to adapt the practices accordingly in order to take new opportunities in the field of research and innovation while remaining compliant with the law. Looking ahead, I would like to mention, of course, the EHDS. This is a major regulation designed to facilitate the sharing and reuse of health data across Europe. The EHDS regulation was adopted in February 2025 to create a single market for health data in Europe. Notably, it aims to make health data available for secondary use, such as for research, statistics, and innovation, while protecting privacy. However, it's only from March 2029 that the first provisions on secondary use will start to apply. The regulation provides for rules on what data can be used and for what purpose and how. Authorized purpose covers scientific research, development and innovation, activities for products or services, and training, testing, and evaluation of algorithms, including in medical devices, AI systems, and digital health applications. So access to data will be managed by Health Data Access Body, and the process takes several months, like up to 8 or 9 months. And that is why it is really important to note that the EHDS creates a common framework for access, but it does not replace or hinder existing agreements that allow for data sharing between organizations. So, like bypassing the EHDS regulation in a certain way. In the healthcare sector, health data reuse and AI are truly inseparable, since health data serve as the essential fuel for training, validation, and improving, sorry, I'm late with my slides, and improving AI in a system in healthcare. So without access to diverse and high quality health data, it would of course be impossible to develop AI solutions for patient care or research. Most of these AI systems are classified as high risk. Sorry, it's a lot. Up. Yes. As high risk under the European AI Act, either because they constitute a medical device certified by notified bodies, or because they are directly mentioned in the Annex 3 of the AI Act. Considering their nature, the AI Act provides for strict requirements applicable to high-risk AI systems in healthcare, including robust data governance. That's a major requirement. High-risk AI systems must be developed using data sets that are relevant, representative, and of high quality. A key point is that AI Act allows the processing of pseudonymized health data rather than only anonymized data, when it is strictly necessary to prevent or correct bias in AI models. And it is where the provision proposed by the Digital Omnibus I mentioned before introducing a new possibility for processing health data under Article 9 of the GDPR appears crucial. In summary, the development of trustworthy and effective AI in healthcare depends on a responsible reuse of health data, which needs to be based on a robust legal framework, but permissive enough to support innovation. While the European framework is evolving and we have built major health databases and data warehouse, France still faces challenge in amending its law and frameworks in order to facilitate the necessary innovation for our healthcare system. In particular, we need to make health data more accessible for AI development, for pre-screening studies, and for research. The goal is to foster innovation while ensuring strong protection for individuals. So thank you for your attention. If you have any question, I'd be happy to try to answer it.
Thank you.